Right, after a bit of waffling on question 3, I'll be trying to be quick on question 4. Arteries and veins are important in blood vessels. So to describe 2 ways in which the structure of an artery differs from the structure of a vein. Well, very basically, if we imagine, if we were to draw the two, so if we were to draw an artery and a vein, from the outside, similar size, but if we kind of take a cross section through and look to them, they both have an outer layer. Not much difference in that outer layer. This is sort of the kind of protective tissue around the outside. The big difference is that an artery has got this very, very thick muscular layer. Okay, it's got a thick layer of muscular fibres around it here. A vein, by contrast, has a very thin muscular layer around it there. Okay, I just shaded those both in. That's obviously because the artery needs to withstand that higher pressure. This is a vein. Because it's got that thicker muscular layer, it ends up having a smaller lumen, the lumen being this area here, whereas a vein, because it's got less muscle, has a larger lumen. That's just the space inside the vessel. So those would be our 2 points. I would state there is an artery has a thicker muscular layer and an artery has a narrower lumen, that space on the inside. A couple of points again, just a bit of exam technique to kind of mention here. It's really important. It's asking you to compare an artery and a vein. If I just said an artery has a thick muscular layer, that's not going to get me the mark. I have to say, if I'm going to say an artery has a thick muscular layer, I would have to say whereas a vein has a thinner or thin muscular layer. If I'm making a comparison, I'd have to say the artery has a thicker muscular layer and the artery has a narrower lumen. To show that I'm comparing it, just on its own it wouldn't be okay. Third point you could have possibly said there, I think sort of third obvious point you might say there is that veins have valves, arteries do not. They would all be acceptable answers there. So we move down. The diagram below shows the human circulatory system. We just need to kind of remind ourselves where some of these are. We should be able to look at what's coming in where. So we just kind of orientate ourselves a little bit on some of these blood vessels. So L here, okay, is leading into the right atrium, as is N. So L and N both make up the vena cava, okay? That's L and N. They're both leading into the right atrium. Okay, remember this is our right atrium of the heart here, left atrium, right ventricle, left ventricle that should be. So that's kind of the deoxygenated blood. That is, they make up the 2 parts. Basically, one part of the vena cava called the superior vena cava. So N is technically the superior vena cava. It's bringing blood from the head, whereas the L would be the inferior vena cava. It's bringing blood in from the body. We can label up a couple of other of these. So this blood vessel here, if we're just kind of orientating ourselves here, which is going to be M. M is coming away from the right ventricle. It's going to the lungs. It's the pulmonary artery. M. B, carrying the blood from the lungs towards the heart, towards the left atria. That's going to be the pulmonary vein. Veins go towards the heart, arteries away. We've then got a blood vessel here, C this time. So I'm just going to write this over here, in fact, because it's not much space. So C equals the aorta. Okay, this is coming out of the left ventricle. If we just trace it with our pen here, it's coming out of the left ventricle, and it's taking it around the body. Here, some of it going up towards the head, some of it coming down here. So, the rest of this we might need to just know some of the names, but these are all carrying, so these here, they're all going away from the heart. These are all, so this one, this one, this one, this one, are all going to be arteries. If we know the name of these arteries, that they are, it depends on where they're going. So D is going to the liver, so it would be the hepatic artery. F, for example, is going to the kidneys, it would be the renal artery. And let's just change it blue for argument's sake here. These ones all coming out of these organs. They're obviously going back towards the heart. They're going to be veins named on the organ they're coming out of. So this would be, K would be the hepatic vein, I would be the renal vein, etc., etc. J is an interesting one. It's interesting because it kind of leads straight out of the intestines into the liver. It's going to be really rich in the kind of the products of digestion. So when our when our sort of small intestine absorbs all of the nutrients from our diet into our bloodstream, it goes straight to the liver for kind of processing. J is an interesting one. It's just one just to kind of learn for yourself, okay? And J is the hepatic portal vein. Veins it's going towards, and it's carrying it to the liver. It's kind of a portal through which that blood can go. So let's just annotating, let's just looking through what it is there. Let's actually see what the questions is we need to do. So the names, some of the blood vessels in the circulatory system, complete the name of the letter given the name for each blood vessel. Well, kind of from what I've gone through there, we can look back, we can see that C, it's going to be our aorta. We can see that B is our pulmonary vein. D is our hepatic artery. It's the artery going away from the heart towards the liver. And I is our renal vein. So hepatic and renal. Hepatic, anything to do with the liver. Renal, anything to do with the kidney. If we just scroll down again, the plasma in the blood vessels contain different concentrations of substances. Complete the table by giving the letter for the blood vessel that matches the components. Okay, so it contains the most glucose after a meal. Well, if we look at these, we know that the glucose is absorbed in the small intestine after a meal. So the blood vessel that's going to be carrying blood and plasma within that blood with the highest concentration of glucose has to be J. Okay, it's the one that comes straight out of the small intestine where the glucose is going to be absorbed into the bloodstream in our meal. The one that's going to contain the least urea, well, the organ that's responsible for filtering out urea is the kidney. Okay, the kidney's job is to take out urea along with other sort of excess molecules from our bloodstream. So the kidney, the vein coming away from the kidney, I, which we actually know is the renal vein, is definitely going to be the lowest in urea because it's just all being freshly filtered out. And then containing the least oxygen. Well, the blood containing the least oxygen is going to be at the point M, just before it goes into the lungs and picks up new oxygen from our lungs there. So the blood, just before it goes into the lungs, is always going to be lowest in the amount of oxygen available.